Yes. Okay. So.
Are we on?
Yeah. Do you think marijuana is an effective treatment for depression, and why?
I would say in most cases, no. Marijuana has a number of psychoactive compounds, the most important of which, or at least the most researched, is THC. It has several other cannabinoids that haven't really been carefully studied. So the effects are really hard to predict on any individual because we don't know what the blend is, right? I mean, there's different strains of marijuana will have wildly different dosages of THC compared to the other cannabinoids and psychoactive substances. So you get wildly different effects based on the person's individual neurochemistry and whatever they happen to have been smoking or ingesting. But on average, THC tends to reduce motivation, which is already a problem in depression. So, one of the biggest issues in clinical depression is we have a kind of hypofrontality where the person's frontal cortex is not giving them the signal of initiative to be more active in doing things, and now you're introducing a drug that actually makes that worse. Now, on the other hand, marijuana for many individuals has some anti-anxiety effects, so the person might feel less stressed, which can be a problem in depression, but on balance, marijuana does not tend to be an effective antidepressant. There are some exceptions. For some people, it can go the other direction. Some people find that they actually do get energized. Some people find they have an enhanced reward system with marijuana. So, I wouldn't rule it out, but I would say if you took 1,000 depressed patients and randomly assigned them to marijuana or a placebo, and they didn't know which they were getting, I suspect at best you would have about placebo level effect, and at worst you might actually find that, on balance, more people are harmed than helped that are depressed.
Okay. Would you recommend the drug as a treatment for any of your patients? And if you would, what disorders would you recommend it for?
If they are undergoing chemo and need something to enhance their appetite, certainly. If you think about, FDA approved or pending, or at least under consideration, approved uses for marijuana, they tend to be medical conditions where the ability of marijuana to increase appetite comes into play, where its ability to lower intraocular pressure, say with glaucoma, is a factor, or, there are, there's a subset of individuals that have ADHD that claim, at least, and, we don't have really good data on it, but I suspect there may be a subset of individuals that have a paradoxical reaction to marijuana where they actually get a little bit more focused, more locked in on things that they need to be focused on. Many people actually would have worse attentional function with marijuana, but again, some people have quirky reactions where it can go the other direction. We have some people that say that they experience an anti-anxiety benefit, so you could imagine somebody with GAD, they might get some benefit from it. On the other hand, remember, anything we throw at the brain day after day after day, the brain's going to push back, so you can get a short-term benefit with a drug and a long-term detriment.
Right.
So, like with a benzodiazepine or something. So, at least in the short term, some people might experience some benefit from its anti-anxiety effects.
Okay. What are the main effects that it has on the brain, and do you believe they are harmful or not?
It affects the cerebellum, which is seat of motor coordination, so we get less coordinated. The cerebellum also has input into the frontal cortex to sort of help us coordinate our thoughts, so our thinking might be a little less tight, a little looser, which can help, say, with creativity sometimes for some people, but usually hurts when a person needs to be very linear, so they're working on their calculus homework or their organic chemistry. Probably not going to be as focused. As I mentioned earlier, it affects the motivational circuitry of the frontal cortex, so there's a whole amotivational syndrome that we see with heavy marijuana use over time, where the person just gets very chill, very in the moment.
Mm-hmm.
Tends to enhance the functioning of frontal circuits that make us very attuned to the moment. So we, under marijuana, the influence of marijuana, we might be a little bit more zen-like, a little bit more locked in, which, can be helpful to some musicians, can be helpful to people that are performing in a way that they need to be very present in the moment.
Mm-hmm.
But for most of us, probably not helpful, I would think.
Okay. Do you believe in it as a recreational substance, or why or why not?
Do I believe in it? I believe
Like,
it is used as a...
Yeah.
I believe it has
I guess I should
recreational
rephrase that
application.
question. Like,
do I endorse it?
well, I remember in class you said it was obviously less harmful than alcohol. Like,
clearly less harmful than alcohol.
If it were, do you think it's like what they're doing with it in Colorado? I guess that's what half my project's on. How?
Yeah. I think it's hypocritical as a society if we're going to make alcohol legal
Mm-hmm.
and readily available to any teenager to be so strict about marijuana, which is clearly less dangerous.
Mm-hmm.
I mean, to take the most obvious example, alcohol is lethal at blood alcohol concentrations over about 0.5. In marijuana, there's no lethal dose. Alcohol causes huge neurotoxic effects at high doses, chronic use. Marijuana, minimal evidence, if any, of long-term brain damage.
Mm-hmm.
Alcohol's horrifically damaging to the developing fetus. Marijuana, minimal teratogenic effects, usually in most studies.
Mm-hmm.
So, to me, it's just insane, as a matter of policy, to be. Now, I don't use marijuana.
Right.
It's not something that I've been drawn to, but I use alcohol, and
right.
Alcohol's a lot worse for you than marijuana. So
yeah.
How could I possibly look somebody in the eye and tell them that they're somehow morally wrong for using marijuana?
Right. Okay. I guess we kind of went over medical benefits already. Are there any negative effects that you believe people should know about with marijuana?
Yeah, amotivational syndrome. Right?
Mm-hmm.
There's a subset of people that once they start using heavily and regularly, they become much less ambitious. There's also a subset of people that get much more anxious. So we have a subset of anxiety disorder, GAD,
mm-hmm.
panic disorder, people that are regular marijuana users, and they think the marijuana is helping, but when they go off, they find their anxiety disorder gets a lot better.
Oh, really?
Yeah.
That's interesting.
Yeah.
Never heard that. Okay.
A lot of anecdotal evidence among clinicians. I don't have any good systematic.
Yeah, that's interesting.
Yeah.
Okay, there are studies published that link marijuana to killing cancerous cells, especially in the brain. What do you think, or do you know more about this?
I don't. Yeah.
Okay.
I'd have to see it.
Okay.
Most forms of marijuana delivery, through inhalation, would increase cancer risk to the lungs.
Mm-hmm.
So, there'd be a trade-off there, obviously. Right. But if you could deliver pure and if THC is what's doing it, and if it really has anti-carcinogenic effects, then sure, why not? But I just don't know if that finding is held up.
Okay. Do you believe the myth or that it's not possible to become addicted to it, or obviously you can't overdose on it, but do you think it's...
It is addictive, potentially.
Uh-huh.
Yeah, no, that myth arose because THC deposits in fatty tissues, and so if somebody is a chronic user, the sort of the conventional wisdom was, well, there's no withdrawal, so how can it be addictive if you don't have a withdrawal syndrome? And it does have a withdrawal syndrome. It's just that you get a sort of a natural time release out of your fatty deposits when you stop using, and so it makes the withdrawal for many people not too bad. But
mm-hmm.
We see a withdrawal syndrome. People get really irritable and lose concentration, sometimes get nauseous, lose their appetite. There is a withdrawal, there is a dependence, but it's just a lot milder than most other forms of addiction, a lot less destructive for most people.
Okay. That's my last question. Thank you so much.
You're welcome.